Whatever we practice in primary care as family physicians, as general practitioners, the guidelines, or I would say the local guidelines, are not developed yet. I see there is a huge gap which we face for so many years, that we do not have specific local guidelines to guide our clinical practice every day.
You know, almost all of the medical knowledge that's currently in medical books, at least 90% of it, comes from just about 10% of the world's population. And that means, if you think about it, that the vast majority of the world is actually not represented in medical research, and that is why we built the AKU Manual of Clinical Practice Guidelines. And what it has is, it has 140 different guidelines that are all based on the best possible evidence globally from around the world, and what evidence is available in Pakistan and in this region.
Today there are over 11,000 physicians across the country using it. From Khuzdar to Karachi, from Loralai to Lahore, all over the country people are using this manual. People who are scrubbing into surgeries read our manual before they scrub into those surgeries.
My first instinct was like, wow! I saw it, that how thoughtful it is designed. And they have every section of every specialty and every important topic. Why I didn't know about this before? International guidelines of medical practice are changing every day. And as a medical student or as a practitioner, we shouldn't be just stick to the old method. We should be learning and upgrading our practice.
10 years maybe down the line, I think it's going to change our practice for a very good reason, and I think we will be able to improve our patient outcomes with it.
I think standardization of care is extremely important. Whether it's a person in a village who's working in the farm, or whether it's a healthcare professional themselves, why should people receive a different level or quality of care, right? Just because of who they are in society. It goes to a fundamental issue of equity. There's an expression which says, the rising tide lifts all boats. So if we can make a difference and improve healthcare delivery in the government setting, in our private institutions, in all different parts of the health system, together, right, we will rise and be able to better serve our patients.
In the next year, our goal is to develop and launch a guideline for pediatrics. As you know, 50% of people in the country is children. So it's essential that we have guidelines for children too. The second thing that we are working on is a patient-centered manual. We don't just want to empower healthcare workers, but individual patients as well, so that they can take care of their own healthcare.
So of course, the AKU Manual of Clinical Practice Guidelines is easily accessible in 3 specific ways. You can actually access them on the web. There, of course, is second, the app, which is on both iOS and Android. And then for those of us who still love books, I'm one of them, you could buy it from numerous bookstores across Pakistan.